So first of all, I would like to thank Inspiria Knowledge Campus for giving us a wonderful and greenery filled campus to be used for today's walkathon. And the purpose of today's walkathon is just to provide awareness and to make people understand about the impact of Down syndrome and what are the methods that we have to prevent, or shall I say, to screen for Down syndrome, and what are the methods that we have once the diagnosis is made to prepare the parents for a Down syndrome baby. That is the main purpose of a walkathon. So India is right now I would say, the country with the most number of Down babies born per year in the world. So the incidence of Down syndrome is around 1 in 700 births per year, which translates around 50 to 60,000 Down babies per year in India. And Down syndrome is a very big part of the healthcare burden on our country's health infrastructure. And Down syndrome per se is not the end of the line, I would say. But yes, it does have its challenges. So nowadays in 2025, if we say that we have not screened for Down syndrome, is something I would say is not acceptable. So that is the impact of Down syndrome in our day-to-day practice. Me being a fetal medicine specialist at New Ramakrishna Seva Sadan, so our primary job is to provide the different choices the patients have for the screening of Down syndrome. So basically there are three main screening tests. Number one is combined first-trimester screening, that includes the nuchal translucency scan and double marker screening. Number two is the quadruple screening test starting from 16 weeks onwards. And the most advanced and the best test is the NIPT. NIPT, I would say right now, is the best test, has a sensitivity or the ability to pick up Down syndrome fetus in around 99% of cases with a very, very, very less false positive rates. This can be started from 11 to 13 weeks as for combined first trimester screening, from 16 weeks onwards for quadruple screening. NIPT can be started from 10 weeks onwards. So these are the various testing methods that we provide to the couples who want to know whether the babies can have the chance for Down syndrome or not. And what I want to absolutely emphasize at this point is that screening for Down syndrome is not optional. You don't get to choose whether you're testing for Down syndrome or not. Just like you don't choose whether you want to take an iron or calcium tablet or folic acid in your pregnancy, you should absolutely screen your baby for Down syndrome. This is absolutely mandatory in today's age and world. This event is not only for the doctors, this event is for everyone. The awareness of Down syndrome, the awareness of screening for Down syndrome, the awareness of the implication of Down syndrome baby is very, very less in our society. And there is a specific stigma associated with Down syndrome babies, because look, Down syndrome babies can have structural abnormalities like VSDs or holes in the heart, skeletal abnormalities. They have a higher chance for childhood cancers like leukemia. But the most debilitating part, I would say, in their life is that the chances of a lower IQ. And due to this chances of lower IQ, there is a specific stigma that is associated with these babies in the society. And so parents are hesitant to take advice, hesitant to take counseling for this. And what I would like to spread a message through this walkathon is that first, the screening for Down syndrome is available for every couple in pregnancy. You have the right to know whether your baby has Down syndrome or not. And number two, just because the diagnosis of a Down syndrome has come doesn't mean it's the end of the line. With proper guidance, with proper support, these babies can lead a very fulfilling life. Very happy and fulfilling life. So as you can see in that t-shirt, we have written walk for every extra spark. The extra spark denotes the extra chromosome that is present in the 21st chromosome in our karyotype. So basically we humans have 23 pairs of chromosome. The extra chromosome 121 called trisomy 21 is the cause for Down syndrome. So this walk for extra every spark means that we're not only working for the diagnosis of Down syndrome, we're also working for the nurturing and resilience of Down syndrome babies in their lives. Per se, genetic syndromes are not preventable. So what we must understand, Down syndrome is not a symptom, it's a genetic syndrome. And being a genetic syndrome, as per now, there is no treatment which can be used to treat this extra chromosome. When a baby is born, 50% of genetic material comes from the father and 50% from the mother. So, and as the mixing and matching is done, there is always a chance of chromosomal abnormalities and aneuploidies. That being said, we can screen for these genetic syndromes. We cannot prevent them, and we cannot treat them. Yes, definitely in the near future, there are some exciting genetic therapies coming, like CRISPR therapy, which have been approved for very small case studies. But as of now, technologically, I personally feel we are 5 to 10 years away from gene therapy to prevent the genetic syndromes. So my long-term vision is that every pregnant mother should have a Down syndrome screening. So I firmly believe that every pregnancy should have 5 important tests done other than the routine testing we do. So NT scan is a must, Down syndrome screening is a must, anatomy scan is a must, and at least one or two growth scan is a must. So this 5 tests, I believe, is the universal right of every mother, and this should be done in every pregnancy. That is my long-term belief, and also my long-term commitment and my long-term hope is that we provide some succor and we provide some awareness about Down syndrome to all people, and to every woman who is thinking of getting pregnant, to every woman who is pregnant, and to every woman who has a Down's baby. A Down's baby have a very good chance of a nurturing and fulfilling life. So with proper guidance and support, we can really in today's day can give them a chance to be a very good part of our society, and that's the message I want to spread around all throughout the community. Thank you very much.